Pain is an important concern for every surgical patient. Here are 5 ways to help control your pain at home. Number 1, medications. You'll be prescribed oral pain medications at discharge. Take them on a scheduled basis to stay ahead of the discomfort the first few days after surgery. Try to take pain medications 30 minutes before activity. If you are prescribed a muscle relaxer after surgery, please make sure to take it if you are experiencing any muscle cramping, spasms, tightness, or stiffness. Number 2, ice. Ice has many benefits after surgery, including reducing swelling, bleeding, and helping control muscle spasms. Use an ice pack or a cryo cup for 20 minutes at a time. Do this a few times a day and do not apply ice directly to the skin. Number 3, movement. Frequent changes in position are recommended every 30 to 45 minutes to prevent stiffness. Put yourself in comfortable positions and use pillows for support while lying on your side, your back, or sitting up. You'll want to be walking for a total of 30 minutes a day. When you change positions, get up and take a walk around the house for a few minutes. Don't use a treadmill until after your first follow-up appointment. Once you start to feel better, then you can gradually increase your walking distance. Number 4, rest. Along with activity, you also need to give your healing body rest and recovery. Let discomfort be your guide as you increase your activity and take short, frequent rest periods as needed. Be sure to have housework done before your surgery, such as laundry, vacuuming, and sweeping. Number 5, relaxation and distraction. Discomfort after surgery can be physically as well as emotionally draining. Relaxation exercises and deep breathing can help relax your muscles and reduce your pain. Reading, puzzles, word searches, and listening to soft music or watching TV can help distract you from focusing only on your discomfort. Let's do a quick breathing exercise together to show you what we mean. Sit up straight as we take 5 deep breaths together from our diaphragm. Put one hand on your chest and one hand on your stomach. Your belly will push out if you're doing it correctly. We're going to extend the length of our exhale as it helps our nervous system relax. You can do that through pursed lips. So here we go. Inhale, 1, 2, 3, 4. Exhale, 6, 5, 4, 3, 2, 1. Inhale, 1, 2, 3, 4. Exhale, 6, 5, 4, 3, 2, 1. Inhale, 1, 2, 3, 4. Exhale, 6, 5, 4, 3, 2, 1. 2 more. Inhale, 1, 2, 3, 4. Exhale, 6, 5, 4, 3, 2, 1. Last one. Inhale, 1, 2, 3, 4. Exhale, 6, 5, 4, 3, 2,